They include 16 informal settlements that are earmarked for de-densification, as well as in the 2 metros. The next slide is where you are then indicating the delivery of water. Again, I'm not going to get into that detail, except that we're making a point on the left-hand side that 5,284 tanks have been allocated, and 5,050 have already been installed, and the remaining 284 are still under installation. And we're also making a point that 744 of those are actually in informal areas. The next slide, Honorable Chair, is in relation to water delivered to schools. We're just making the point that we targeted 756 schools, and now 97%, which constitutes 734, have actually been supported. The next slide is, which is 30, is just indicating the level of schools that for phase 1, which was the return of grade 7 and 12, there is 1 school in the province that really couldn't open owing to infrastructure issues, but procurement of those classrooms is underway. But those learners, I must emphasize, Honorable Chair, they continue to receive lessons via, the virtual platforms. But we're indicating there what then we have observed since then, that 1,346 educators got infected. We have recorded 48 deaths, and that in the non-teaching space, 190 non-teaching staff infected, 10 deaths, and so on. I will not read the entire diagram. Then the next one, Honorable Chair, we're just making a point of the experiences there that we have acquired, or we have come up in relation to the high enrollment schools. As honorable members would have noticed, schools like St. John's College, like Makaula Senior Secondary Schools, were picked up that set of lessons in terms of why those schools were affected in the manner in which they did. And those lessons are helping us in planning for the next phase of the return of learners. The next slide, which talks to phase 2, which is grades 3, 6, and 11. As at the 10th of July, we were at 93% in terms of delivery of PPE. I've not checked, Honorable Chair, as of, for example, yesterday, but I'm pretty certain that that number has improved a lot. In terms of the water availability, again, those numbers I think we did share. In terms of the sanitation, we've been able to deliver to 488 of the 508 schools. In terms of the next slide, that's just the timetable, that's just the plan of how to phase in the other grades as they are indicated there in terms of those dates. But of course, as we know, Honorable Chair, there is still a lot of this discussion that's taking place, but from the planning point of view, that is what we have planned. The next slide, which is slide 34, we're just indicating there at the level of employees with comorbidities, that's the picture that we are having in the area of education, because in an attempt to manage that area, we have asked those who then have those underlying conditions to submit applications indicating how much has been received by way of those applications and how much has been processed, approved, not approved, and so on and so on. But all of this, in terms of the pop-up, we're just indicating that we look at it to be like it will require 3,591 substitute or assistant educators, so as to help in situations where those educators would not be in the classroom. Although, again, I want to emphasize, Honorable Chair, they will continue to render lessons, but it's just that that would be virtually done. Hence, you need assistant educators to be able to do other things like collecting assignment books, test books, and so on physically at the level of the classrooms. The next one is where we're dealing with psychosocial services. I would just want in the slide 36, that is that as it obtains in the area of education, that's how we've organized our psychosocial support plan in education. The slide 37 are the practical steps. For example, we have an app that is there, that has been developed, that's extended to learners and as well as parents by way of supporting them. And we have given out that toll-free number that they can use. And then the slide goes into that detail. But as the province, we have also realized that we need a much more integrated approach in terms of psychosocial support. In terms of 38, that's just the detail, Honorable Chair, in terms of the work that we are doing in that space, in particular led by the Department of Social Development. On slide number 39, we then indicating, for example, number of people cancelled, and so on, all of the data that we have in that space. I'll move to slide number 40, Honorable Chair, that talks about our ward-based response plan, which, with due respect, I will ask honorable members maybe to go through it. But in essence, as I was indicating, it just indicates how are we wanting to execute the campaign at a ward level using our social and community mobilization pillar. We're just detailing there what are we seeking to achieve, what is the state. I will move straight to slide number 46. On slide number 46, again, we're indicating there, Honorable Chair, what are the focus areas of our ward-based rapid response teams, what are they doing in terms of education, in terms of awareness, information, and so on and so on. I won't, again, go into detail there. The slide that is 47, I'm sorry, Honorable Chair, we're saying there, having profiled the province, we have been able to pick up from the data that we have, what are the, which ones are the top 100 wards in the province, and those that are listed there per municipality are the most infected wards in our province. Because remember, our strategy now is that of a targeted strategy rather than when we started in a mass testing approach, for example. That's why we need then to be more focused, and we have zoomed that into the specific areas of how many we have screened in this in each municipality, and so on and so on. That's the detail, but giving the same information as in the previous slide. I would want to move, Honorable Chair, to slide number 50, which is about the economic recovery. If you recall, in our strategy, we said we also are focusing on the future, on building the future. In terms of that, at a macro level, those are the objectives that we seek to realize in terms of our plans, economic growth, employment, and so on and so on. I would like to move to the next slide. In the next slide, we're indicating there what are the instruments that we are using to intervene in the various areas or sectors of the economy. The province has targeted those instruments in the main that are listed there. The next slide is in relation to If you were to go to our annual performance plans across departments, across municipalities in the province, what are the key projects that you are likely to see that are contributing to economic recovery? In those slides, Honorable Chair, we just mentioning what those projects are. As I say, some would be at level of municipalities, some would be at the level of provincial government. In fact, I must mention even state-owned companies in the province, they are contributing to this. Even departments of national government in the province, they are contributing to this. Slide number 55, that is giving a report, an update on the Jobs Fund, where we're indicating, Honorable Chair, 3 businesses, for example, have benefited from that, and the total job impact of that is 581. In other words, we would have lost those jobs had we not, through the Jobs Fund, paid out that 5 million rand. And then the slide continues. That's just the information that we're giving in terms of the interventions by the Job Fund saving those kind of jobs. The next slide, all of these slides, Honorable Chair, they are merely indicating the work that has been done in the various sectors of the economy in terms of the current level 3. What are the things that we ought to see? And we're taking there whether some of the compliance issues in terms of the work that we have been doing, have been achieved. And those are the slides. I'm not going to go through each one of them. That is the meaning behind all of those slides. In terms of 57, we're merely sharing there the agriculture and agro-processing plan of the province, which in the main is anchored on revitalizing the agriculture infrastructure in the province and making sure that what used to be the food basket of the country in terms of this area, we can still go back to those glory days. I'm not going to go to 58, 59. I think is almost giving the same detail of the message that I've already put across. I'm going to go to slide, Honorable Chair, 61. In terms of the oceans economy, as we know, those are the areas of focus, but even with the oceans economy, those are the that's the work that were picked up through observing compliance and so on in the sector. In terms of tourism, it's the same thing. The environment is the same thing. In terms of the labor sector, we're indicating there, Honorable Chair, that 27 billion rand has been paid out towards UIF applications. Of that national disbursement, 1.5 billion has actually been disbursed towards the Eastern Cape, and thus supporting 336 jobs that otherwise would have been lost. That, Honorable Chair, is just the, again, summary in terms of the 2 main economic hubs of the province. How many people have been dismissed, and which ones on the right in terms of the operational requirements. I think it's summarizing everything else above that we made reference to. On slide, if I may skip all of these slides because they are conveying the same message. On slide 71, in relation to the small businesses and informal sector, we're just summarizing there, Honorable Chair and members, what has been the investment by the Department of Small Businesses in terms of supporting small business development, in terms of supporting small businesses in the province, including the informal sector, where we're indicating, for example, that the number of SMMEs are that 151, the ones that have been approved, an amount that has been approved is that 55 million, and so on, up to the end of that slide, Honorable Chair. In terms of transport, we're indicating that scholar transport got to resume at the time when the phase 1 of grade 7 and 12 were going back to school, and that benefited 1,395 operators. We're also indicating that the financial relief of about to about 12,000 minibuses and 176 mini meter taxis across the province. We're also indicating that the province has spent 3.6 million that's benefiting SMMEs in the province in terms of the various procurement processes. As at the time we compiled the report, the East London Airport and Mthatha Airport had not been permitted to operate. I understand that the Honourable Minister was making announcements this afternoon. It may be that that picture has changed, because we were expecting East London Airport to also be ready to open. The one that we knew was Mthatha Airport, that it was going to be delayed a little bit, but Port Elizabeth Airport has already started operating. Further down in terms of the transport sector, we're just indicating some of the projects, Honourable Chair, that the province is undertaking in relation to making sure that the infrastructure work continues to happen, that the livelihoods of our people continue to be supported. Those are the projects that the province continues to implement. I'm on slide number 75 in terms of partnerships. Again, that's the list of partners, Honourable Chair, that we have been able to mobilize in the province. They range from the medical support of the South African National Defence Force, the Cuban professionals, PPE, field hospitals, and so on, all of those in the areas that are indicated there, ventilators, beds, and so on. We really are very grateful for this support, because you would recall that we mentioned that we have a budget shortfall when we started. This support is coming in handy in terms of meeting us halfway in that regard. The elements of business continuity in terms of employees going back to work in the various government departments, which is indicating, Honourable Chair, that the issues of ICT have come in strongly in that regard to test the state of our readiness for employees to operate remotely. And then we have undertaken all of those plans, as well as the progress that we have made against those plans and the work that we still need to do in that regard. I will not go through each one of the slides, Honourable Chair, but excuse me, in essence, we're indicating there that business continuity is a big issue. On slide number 83, we're summarizing there what has been the impact of COVID-19 in terms of government employees across all departments in the Eastern Cape. And I must indicate, Honourable Chair, that this data excludes municipalities, is provincial departments. You can see from that table that the Department of Health is highly affected, and that's followed by the Department of Education. Those numbers include health institutions, they include schools, and then other departments are following. And when you lose 78 of your frontline employees, it's really difficult. You still have 3,534 that got infected. Of course, some of those have recovered, but we're just making the point that they got infected. And the impact of this, Honorable Chair and members, is that there are those times then, like now, we're working on preparing for submission of annual financial statements. It's a struggle because sometimes those that are critical in those roles, they get not to be available at those critical times. The challenges then are indicated there. In conclusion, Honorable Chair, we're making the point that the hotspot areas in the Eastern Cape are Nelson Mandela, Buffalo City, Chris Hani, and OR Tambo. But as we are seeing the infections surging, you'll find that if we don't act and do certain things quicker, it may be that the entire province then gets to be engulfed, and then the whole province is really a hotspot. But for now, we're still able to distinguish those four. The next point we are making there is the issue around communication and enforcing and adherence to regulations that I made earlier on. At the beginning, Honorable Chair and members, we had a big issue about inter-provincial movement. And we had to have a lot of discussions with the Western Cape in particular, and the minister was also involved with other ministers in helping us facilitate understanding in terms of what protocols should obtain and apply between the two provinces, because that's where most of our problem originated from right at the beginning. But as of now, Honorable Chair, that space is better managed now compared to then. The same thing with the SASSA payments, payments of social grants. At the beginning, we struggled a bit, but we have been able then to rise to the occasion and take charge, supported by the South African Police Service, as well as leadership at local government level, ward councillors and other councillors, making sure that they marshal queues when those social grants are being paid. And therefore, even there, we have improved a lot. I've spoken to the ward response. The province is in the process of acquiring additional resources insofar as healthcare workers, insofar as psychologists, counselors, social workers, educators, beds, as well as ventilators. Those are the key resources that we need to augment in the province if we must succeed in terms of this campaign. Honorable Chair, my apologies if I took long. That is the report of the Eastern Cape. Thank you very much, Honorable MEC, for affording me the opportunity.
Hey, I think I'm there to have. Honorable Chair?
Yes, I'm here. Thank you so much. Then you don't want to round up, you're fine. You're sorted.
Yeah, I'll like to make just 3 points, Honorable Chair. That represented
removing. While you do that, can you ask the team to remove the presentation from the screen? Thank you. Yes,
that's that.
You can proceed.
Yeah. That's the presentation of the province, Honorable Chair. Just to make this point that as a province, we welcome the new regulations that sought to strengthen restrictions on level 3. You'll recall, honorable members, that our Premier was the first one to call for the ban or suspension of alcohol, because the evidence that we've also seen in the province, how many car accidents, how people were injured, and therefore, taking a lot of spaces in hospital, and therefore that decision is fully welcomed in as far as our province is concerned. The other point, which is quite critical, that informs our work, that informs our decision-making process, is the fact that we have got a data center that analyzes this information, working with CSIR, analyze the information, which then informs us where the concentration of the infections is in terms of the wards, the 100 wards that we have determined, so that we use this targeted approach of test and tracing. as an approach, because we're of the view that this operation Masiphathisane, we should really, as a response to the president's call, that is, it is in our hands, so that the people are actively involved at a ward level in fighting against the virus, so that we begin to arrest the level of infections at that level. That's the point. The other point, Honorable Chair, which remains the weakest link in the province, the whole issue of funerals. And we are making every effort, because many of the infections, they came as a result of funerals and the traffic between the provinces, because our province is a labor-centric province. Whether people are in Joburg, they end up buried in Eastern Cape, whether in Cape Town, in Western Cape, the same. And